Everyone know what heparin is. Heparin is an anticoagulant. So if somebody gets a blood clot, they usually give them heparin. They start out with heparin. Like if you go in the hospital, they'll give you heparin, regular old heparin. Now, heparin is a natural substance. It's made by our mast cells, which are cells part of the immune system. So they usually show up at a situation and they produce heparin. And heparin blocks, it actually does a couple things. It blocks coagulation, blood clotting. The question is heparin. Heparin is actually protective too because it's anti-angiogenic. So to answer your question was, is heparin good with cancer? It turns out to be anti-angiogenic. But what is better than the regular heparin that we've always been talking about, that we knew about for years? Like for years, we would give to people who had blood clots in their leg, a blood clot in their pelvis, their arm, wherever they had a blood clot, we'd treat them with heparin, and then they put them on warfarin, which is a terrible drug. It's the one that you well known as rat poison. But now they're developed what are called low molecular weight, which is a fractionated portion of the heparin. Low molecular weight heparin, enalapril, it's also called Lovenox, and that turns out to be even better in terms of anti-angiogenic, preventing. Now, why is that important? Because if you stop new blood vessels, angiogenesis, angio meaning blood vessel, genesis meaning beginning. If you block angiogenesis, you have no new blood vessels growing. Cancer can't grow and it's going to die, all right? And you definitely won't have any metastasis. So blocking angiogenesis is very important. Well, heparin does that. The low molecular weight heparin, not necessarily the regular heparin, but the low molecular weight heparin. So, and the way this all came to be is that they found out that people who, for example, had surgery and or had a blood clot and they were put on heparin, they were put on anticoagulants, even warfarin, for a while. It prevented metastasis for 2 years or so until they got off the anticoagulants. Why is that? Because the anticoagulation mechanism and blood vessel growth mechanisms are very similar. Okay, so that's why it's not like it's some odd thing. Why would this be? Why would heparin have anything to do with angiogenesis? It's because blood clotting, it's all blood vessels and blood flow, and they're all working on the same system. So to answer that question, it's actually good. And what